Welcome to the Spark Live webinar series, one component of our Spark Knowledge Mobilization Program. Spark is Children's Healthcare Canada's shared platform for advocacy, research, and knowledge. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live bi-weekly webinar series. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box visible to all of our attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark News e-bulletin by visiting our website at childhealthcan.ca. Hello everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live bi-weekly webinar series. I'm Paula Robeson, your host for the next hour. Children's Healthcare Canada acknowledges that our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin Anishinaabe people. We recognize and deeply appreciate their historic connection to this place. We also recognize the contributions that Métis, Inuit, and other Indigenous peoples have made, both in shaping and strengthening this community, our province, and the country. Today, we're delighted to bring you Aanish Naa Gegii, the Children's Health and Wellbeing Measurement and Resources for Indigenous Children. Just a reminder that all our webinars are recorded. As mentioned in the introductory video, please type your questions into the question box at any time, and I'll prompt you via the chat as well. I will pose the questions to our speakers throughout the session as they prompt me. Now I'd like to introduce our speakers for today. Mia Burke is the Community and Cultural Liaison for the Aanish Naa Gegii Children's Health and Wellbeing Measure. She is Anishinaabe from Western Quebec, who is extremely passionate about language revitalization, indigenization, and learning the traditional hunting and fishing ways of her people. And Lily Racine Bouchard is the knowledge translator for the Aanish Naa Gegii team. She has completed degrees in both biologie, biomédicale, and health promotion at Laurentian University. As a natural leader and active volunteer in her community, Lily has developed many strong connections and partnerships, and she holds several years of experience in education and communication, developing and implementing plans for Indigenous populations across the North. It's my pleasure now to pass the mic to Mia.
Hello, everybody. Kwekwe, my name is Mia Burke. As Paula mentioned, I'd also like to acknowledge the territory that me and Lily are situated on. So we're on the traditional territories of the Atitmiksheng Anishinaabe, which are situated in the Robinson-Huron Treaty of 1850. And I'd also like our listeners to also acknowledge the lands that they are situated and working on today as well. So we'll just, this is the agenda for our webinar today. So we will give you a quick introduction of the Aanish Naa Gegii Children's Health and Wellbeing Measure, an introduction to our resource hub, mental wellness resource examples, mental wellness program, our mental wellness program compendium, as well as future resource hub work from the ACHWM. So like she mentioned, my name is Mia Burke, Community and Culture Liaison for the team, and I'll let Lily introduce herself too quickly.
Hi, Paula already did a very great introduction, but again, my name is Lily, and I'm the knowledge translator for the ACHWM.
So now that I've gone over the learning objectives, the agenda, I'll be going over the learning objectives. So I want you folks to understand what the ACHWM is, our history and what we do, to understand the importance of culturally relevant and culturally safe wellness measurement tools and resources for Indigenous children and youth. To understand how to access and apply the ACHWM as a culturally relevant measure for Indigenous children's health and well-being. And finally, to understand how to access and adapt our resources and our wellness resources for the needs of Indigenous children, patients, and clients.
And before we go too deep into the Resource Hub itself, I do want to give a brief introduction of what the ACHWM is, which is Aanish Naa Gegii Children's Health and Wellbeing Measurement. So what we really started out to be is a tablet-based health and wellbeing survey. It's a 62-item well-being assessment, and it's used for children 8 to 18 years old, Indigenous children 8 to 18 years old. And it was really developed for Indigenous children across Canada, but it was also developed with Indigenous children throughout the way. And we had a group of an advisory committee who really helped us develop these questions along the way. And this helps identify children that are at potential risk, and it helps just connect the children to local services if required. And sometimes those connections might be, you know, a nutritionist or a counselor, but they can also be really positive you know, intakes. So maybe referring a child to a leadership program or somewhere they can really grow and improve. So just to give a little sense of where the ACHWM came from, the original idea of the Indigenous health measure came from Mary Jo Wabineau, who was the health services director in Wikwemikong and Ceded Territory. And she had a need for local data to guide the health planning and delivery. And so it was Mary Jo that reached out to Nancy Young, who was the measurement scientist at Laurentian University. And Nancy really brought that research expertise and her resources to enhance the scientific credibility of the measure. And so with that was a really strong collaboration and a really strong partnership that was developed. Earlier, I did mention that it was the Indigenous children and youth who came up with the questions. And so it was children in Wikwemikong and Ceded Territory who selected the questions, the topics and the wordings through these Photovoice activities, along with focus groups and interviews. And so you can see here a couple examples of things like balance and activities and things. Basically, they went around the community and they would just take photos of what meant what wellness represented to them. And so if you see to the right, there's a photo of a boy holding out his arms, and that's at the baseball field. And at our first thought was, oh, it's baseball field, this is physical activity. But really, they were looking at language. This baseball field is in the Anishinaabe language, and that was really important to them. And that language and that cultural piece is really important to the wellness. And so all these ideas were translated into questions about balance and language and more. And this collaboration really gave children a voice in their own health assessment while ensuring their safety by demonstrating that we are listening, we're here to grow, we're here to, you know, be better together. So since 2014, the children of Wikwemikong gave the ACHWM its ACHWM Name, which is the Aanish Naa Gegii, which means how are you? But since then, a lot of other communities have named it "How are you" in their own languages. These are just a few examples. So in Michif, we have Como Savo, Inuit, which is our Inuit communities, named it Kanwipe, and so on and so forth. So it's really great to see that communities are renaming the project to something that connects best to them, their community, their children, their language.
Now we're going to get into the Resource Hub, and that's what brought you here today. So the Resource Hub was developed because we had a rapid response knowledge synthesis grant from CIHR, so the Canadian Institutes of Health Research. And the project was to respond to the impacts of COVID-19 on mental wellness, and specifically in our case, Indigenous children's mental wellness during the pandemic. So we created two groups of resources. So the first one being mental wellness resources, but also a compendium of mental wellness programs. And the goal of the Resource Hub was to be a continuous knowledge exchange with communities across Canada.
Right. And so since then, Sorry.
Oh, go for it. Yeah, go for it.
I was going to say, since then, we've really grown our resource hub. So we're pretty excited to show you the steps that we've gone through to creating this hub. So previous ACHWM work highlighted the importance of programming for children at all levels of need. So not just at times of crisis. And by analyzing the data from 5 different communities, we defined 3 zones to classify these needs. So we have the green zone, children who are thriving, the yellow zone, children who are coping or surviving, and the red zone, which is for children who are in or are approaching crisis. And these zones formed a basis for review to identify what existing tools, best practices, and resources could be leveraged to promote Indigenous youth mental wellness at each level of need. So we're really supporting Indigenous children at every step of the way, no matter where they are. And so that's where the Resource Hub was really designed to, to help support Indigenous children and those who support Indigenous children. So perhaps parents, teachers, mental health workers, program leaders, etc. And so, like Mia mentioned, we have 2 main initiatives of the Resource Hub, and that's the Mental Wellness Program Compendium, and then the Wellness Resources and Deliverables. So the first initiative I'll chat about is the Compendium of Indigenous Mental Health and Wellness Programs. This is where we reviewed programs that support mental wellness for Indigenous children and youth based on key features that make sure that they are community-based, they are strengths-based, which is really important, it's land-based, and they also had to support mental health for children and youth, be culturally relevant, be feasible in lower resource context, so places that are a little bit more remote. And of course, they had to demonstrate evidence of effectiveness, so that this is something that's been implemented and we know that it works. And so we evaluated the relevance and feasibility of each program to rural and remote communities and documented the level of evidence supporting its effectiveness. And so with that, basically, we have this compendium where we put all these resources who fit these criteria into one location so that it's easily accessible for anyone who might need it. And then the second part was, the activities, the motion charts, the resources and deliverables portion. So some of the examples that I'll share with you are these public resources. So the CAMH. We have the Inuit Women of Canada Community Story Workshop Model, books for children and youth that are great for Indigenous populations. Hope for Wellness Helpline is a helpline that is in many different languages, Indigenous languages. And then we have a variety of 2S LGBTQ resources for Indigenous people as well. So these are just a few of the examples, but it's really comprehensive. I mean, the whole idea was to be as inclusive as possible, and it is an ever-growing resource list. And then if we go into the deliverables and the activities, you can find a collection of these existing and new resources that address mental health literacy and stigma, including culturally safe activity sheets, coloring pages, exercises, facilitator instructions, etc. And all of these really great things were co-created with a team of just empowering and amazing people. So we had Indigenous child psychologists, Indigenous community members, Indigenous social workers, Indigenous artists, just a really great, well-rounded support team who created these resources. So another example would be the language resource, which we thought was really important to incorporate different language dictionaries, again, all in this central hub for, our teachers and our social workers and et cetera, for that easy access.
So now we're going to talk about customization. Throughout the process of creating our resources, we wanted to emphasize customization for communities across Canada. So our resources are you're able to download them in a PowerPoint form as well as PDF for accessibility, as some schools or some offices might not have Microsoft Word, so they can't access PowerPoint. But the PowerPoint download also gives you the opportunity to change the text. So all the text in PowerPoint is editable and changeable. But so if a community school wants to teach language, they're able to take the text right out and incorporate their own language for a language learning opportunity. Our work was also, it's protected under a Creative Commons license, which means people can't make money off of our resources, but it can be widely shared and distributed among whomever for different purposes. So we really want to just emphasize customization, and we highly encourage communities and members who end up customizing our resources to actually send them back as that helps the knowledge translation, right? That helps expand. If some communities maybe don't have language speakers of a certain language, and another community, they happen to translate these resources, then those children have access to those resources in their language. So yeah, so customization is heavily emphasized and highly encouraged. So one second, I lost you folks. So the development of the mental wellness resources was collaborative, like Lily had previously mentioned. So they were designed for those who support Indigenous children's health. So parents, teachers, mental health workers, elders, whomever. And they're also based on local practices. So one of the child psychologists we work with, Diva Little Mustache Gordon, she worked in the school in Moose Factory. She created some resources with us that were really indigenizing her practice and really incorporating nature and language within her practice. So we'll show you some examples shortly. And also our resources include facilitator guides. So guides whoever's helping the child along the way. Perfect. So these are the resources available. So once you're into our website, these are free. You can download them as many times as you want. You can send them to whoever you want. You can print them. You can do whatever you want. So this is the first one. So this is one that Diva helped us with. So it's a breathing exercise that incorporates the walleye, and we've got pictures to show how it's done. And this one also comes with a facilitator guide. And like I mentioned previously, you could take all the text out and put it into whichever language you wanted. This is just a different version. So this is in a northern Cree dialect from Quebec. So in the syllabics of a butterfly breathing, which is another one from Diva. And then in French, we've got teepee breathing. So this is our third version of breathing exercises. And I also want to emphasize for this one specifically, it's to not just use in times of crisis, like Lily mentioned. This is just a really good way to normalize breathing and self-calming. So this is good in any circumstance and not just in times of crisis. So this is what the facilitator guide looks like. So this could be printed and used in a classroom setting or however the facilitator would want to use it. So this is a set of coloring pages we had designed by Anishinaabe artist Nigani. So she created several different coloring pages for us. We put healing is healthy in the little box just as an example, but like I previously mentioned, this text can be taken out. It could be blank if you wanted the child to put a positive affirmation themselves, or if you want to incorporate one in the language, it's totally up to you, but we just put healing is healthy. And then the next slide is another one of her coloring pages. So there's a couple different ones up there, and we're currently looking at getting some more artists to create different coloring pages to be inclusive of other art that's out there amongst our Indigenous peoples. This is a mindfulness tracing exercise like the breathing exercise, it's good to use this at all times and not just times of crisis. So the child goes over with their finger and traces it. And this was a suggestion from Diva, who is the child psychologist in Moose Factory. And this is just another version of it, just to be inclusive of our Indigenous peoples across Canada. So we try to kind of touch a little bit of everything to be reflective of all our people.
And I'll just jump in here quickly, Mia. And I know you can't see the chat box right now, but we're getting a lot of really awesome feedback about people who are enjoying these resources and complimenting the coloring pages. So just taking a minute to say thank you to everyone who is writing in the group chat. We see you. We appreciate you.
Thank you, everybody. So these are an activity sheet that we created called What Makes Me Happy. And we've got different versions of these to represent First Nation, Métis, and Inuit children. So this is just a really simple exercise that's quick. And I think it's also important to create resources for our Indigenous teachers out there. It's at times can be really stressful, especially during the pandemic. So it's really good to have these accessible to them if they're running out of things to do, or if they need more activities that are culturally relevant and culturally safe, and actually all our images who actually look like Indigenous children, right? So these are great, and these are customizable as well. So when we were creating our resources, we were finding them a little bit, they were kind of reaching the younger crowd a little bit more and less of our teenage demographic. So we created these kind of shareable materials that could be put in a classroom. They look like a Google kind of search box. And we wanted to create this for our older youth, these kinds of positive affirmations that they could relate to. So we've got about 10 of these created, and the text is also changed. You can change it and you can put it to whatever text you wanted. So yeah, we just wanted to reach our teenage population as they're a little bit harder to reach. These following ones were created with another child psychologist who works out in New Brunswick with the Maliseet people. So this is called My World, and this was used in her practice, and we changed it to the turtle to be a bit more relevant and indigenized. So this is a really cool one as well. What I feel inside. So this gives them the opportunity to color or do whatever they want with this one. Oh, hi, Carrie. I see your comment. Do you have any more research? So that's what we're trying to work on currently. We would love to do some focus groups and sharing circles with Indigenous youth, but with the pandemic, it's really, really difficult because we are currently trying to make some resources that reach the teenage demographic, because that's one that we're really missing. So if you have any suggestions for us, that would be really great too, or we can touch base afterwards. So this is an emotions chart that was created by Nigani. The text is editable. Once again, you're going to get sick of me saying the word editable. So we wanted to create this one to really look like Indigenous children, as we're seeing emotions charts and other things like that were very Western and very didn't reflect Indigenous children. So we created this, and yeah.
And this is one of those really fun activities where we really encourage communities to, if they translate it or put it in their own languages or decide to change the name of the emotion, to share back with us, that we can, again, share it with other communities who might benefit from it.
So this is another one. This one, we tried to base it off different teachings from across the country and kind of weave all these different teachings into this exercise. So how are you strong? And you could change the wording to fit different animals if you wanted, if your community sees animals in a different way or a different adjective. So this one's also customizable. And these ones are good for the classroom or for if you're seeing a patient, etc. Balancing your supports is another one. So supporting your community is important for building everyone's holistic health. Helping others can build your own emotional and mental wellness, while accepting help is just as important. So we really strive to be strengths-based. We our resources don't have negative connotations. We're really trying to uplift everybody's strengths in our resources. So there's no negative wording or anything like that. Perfect. So the mental wellness programs. So is this you, Lily?
Yeah, no, this is, sorry, Mia, this is yours. I can go into
sorry.
it.
Sorry about that. So like we mentioned earlier, we have a program compendium that highlights step care. So we went through 43 programs across the country and evaluated them. And 9 of those were reviewed in detail. So the program criteria, they had to be culturally grounded, community-based, strengths-based, and land-based. So these are all in an Excel spreadsheet. So we kind of did the heavy lifting for communities to see what's working across the country, while you don't have to do that work. So that's all in a spreadsheet on our website. And there's also a tutorial video on how to navigate this compendium, as it can be a little bit overwhelming if you're not super familiar with Excel. Like me, I'm a victim of not being good with Excel. So the video is really great on explaining how to use and navigate this compendium of resources. So an example of something that a program that we highlighted and did research on is the Journey to Wellness program. This is based out of Battleford Treaty 6 out in Saskatchewan. So this program is culturally grounded, community-based, and strengths-based. It's a school-based program, and it's eight one-hour sessions delivered once a week. So this was one of the ones that we highlighted in our compendium.
Okay, so just to take a few moments before we get into accessing the Resource Hub, in case there are any questions that we haven't addressed or any questions anyone would like to ask. Carrie, I did write down your email. We would get in touch. And Floretta, I think that sounds like there's a lot of opportunity there. So yeah, feel free to email Mia or myself. Feel free to write down your email in this chat, and we'll be happy to touch base on that.
Hi, it's Paula. While we're sort of transitioning, there were some questions around youth engagement. Now, I know that Carrie has offered to engage some young people that she works with. To what extent were older kids involved in the development of some of those resources targeting them? All our work was done through people working in schools and social workers, et cetera, as we couldn't really meet with children and youth and their communities, and how we want to do things in a good way and done properly and following the right protocols. So as of now, we've not actually worked one-on-one with the older youth to create these resources. That's why there's not a whole lot, because we would like to eventually at some point. So we're working on a youth engagement strategy currently. So we're trying to work with that and get some feedback from youth when it's proper and safe to do so. Brilliant.
Yeah, that's great, Mia. And just to add on that, like Mia mentioned, we do have this strategy, the youth engagement strategy, planned out, which hopefully will involve some interviews and some bigger surveys. And the Resource Hub truly is ever growing, and we're continuing to grow on that. So we definitely notice the gap as well. We're not blind to it, and we are trying to fill it out as much as possible. Thank you, Bethany. We will keep that in mind. Paula, were there other questions that we missed?
Oh, wait, now one just popped in. Let's see. Floretta simply mentioned that she has a youth group here that would love to network as well.
Amazing. Thank you. We're very happy to do all the networking. Honestly, this is why we do it. We're really excited that you're excited. So thank you for sharing and sending your contact emails. We will definitely, we won't ignore those. I did see a question earlier regarding whether or not these resources were free of charge. And they absolutely are. So I will give you a little rundown of how to access them. So they are through our website, through what we call the member portal. So it's a password protection portion of our website. We also do have some packages that we've been mailing, like physical copies of all the resources to community. So if this is something you'd be interested in, let us know in the chat or email us, and we can send you a physical activity. But of course, you can print these out on your own. So what I'm going to do is I'm just going to open the website, which is just achwm.ca. This is our main website. And the main portion of this will, say about us, some of our funding. And like we mentioned at the beginning, we also do the wellness measure. So you can find all the information on that. But really where you'll want to go is you'll go right to the login button, which is at the top right corner. And here you probably don't have a login. So let me just go back so that I can show you how to get in without it automatically logging me in. So oh, and it's doing it again. Let's go log out. So I could just walk you through, because it really is, it seems intimidating because we require a password and an email, but all we need is a website. So you'll go create an account, you'll create a username, you'll put in your email, your password, and then a PIN, which is, you only really need this if you're using the survey. So don't even worry about this. These are all optional. How did you hear about us? Feel free to fill that out. More information, if you want to talk about the Spark presentation, that would be lovely. And then you register. We don't send spam emails. We don't have newsletters, nothing like that. So you don't have to worry about us flooding or spamming your email. And here you go. So now this is what we call the dashboard of your member portal. This is used for a lot of different things because, again, like we said, we have the projects as well. But what you'll do is on the left at the bottom, you see Resource Hub here. You just click on the Resource Hub. And then this is where you'll have everything. So the Resource Hub overview, this goes, of course, over an overview. So kind of like what we're talking about today. So if there's anyone, who might be interested that weren't able to make this presentation, they can get a little bit of a background information here. This is the group program. So, and anything that's bolded and underlined is a clickable document. So here's a group program, full list of programs identified. Let's click on that so I can show you what it looks like. This is the Excel sheet, which can be a little bit daunting, like Mia expressed, but it is very comprehensive. We'll just give it a minute to load here. Wow, and it looks tiny, so it makes it even look worse. But again, we do have a little YouTube tutorial, but so you'll have the name here, the website where you can find it. Here were the 4 requirements that we wanted to make sure it filled. And then a little bit of information about it. This is what zone it is suggested for us. Remember, we had the stepped care, whether the children are in green zone, which are healthy, yellow, which is, coping, or red, which is in crisis. So this is the zone it's recommended for. And then scope. So of course, this is if it has kind of a target area. So as we go through, we can see then we go into like our red and our yellows and our different zones with very comprehensive descriptions. And again, the website link, which is just in the other column. So this is the compendium, very, very comprehensive. And then this is the video. I won't open it, but it's just a short video. You click it and it'll help you browse through how to filter through some of the resources if you're not too familiar with Excel. So that's
for those who don't know. Would you mind explaining just briefly what the step care process is, or if you're coming to it, that's cool too.
Yeah, no, that's fine. We did talk about it at the beginning, but I'm happy to show it again. I believe it's in here somewhere, right here. So the stepped care is that we looked at the children that we've worked with, and we've identified 3 different zones. And so we have the green zone, which is where the children are really thriving. They're great, but it doesn't mean that they don't enjoy additional resources to keep them in this green level. Then we have the yellow, the surviving, where, just surviving or coping, they're doing okay. There's room to get better, but there's also room to get worse. And then we have, in times of crisis, which is our red zone. So that's our 3-stepped care, format that we've identified and that we really built this off of.
Brilliant.
Yeah. Thank you. And here we go. Now I will go into the wellness resources. So this is really the deliverables that we talked about. Mia showed a lot of them, which is really excellent. And here, these are little like anchors. So you can, if you know exactly where you're going, you can click right on it, or you can scroll through. Again, there's some information on the background. And then this is where it's activity spreadsheets. These are all clickable. So the balancing supports child and youth versions available. This is an activity sheet that encourages children and youth to consider how they help others and who helps them to ensure it's a balanced support system. So this is where you can click. Here it says balance support editable. So if you click it, it's going to come up in a PowerPoint format so that you can move things around. You can, once you download it, you can edit the languages if you want to make it in, your own language, or if you want to have your own examples, customize it however you feel is appropriate for, your environment and your population. So we do have it in English. We also have it in French, and they're both available either in PDF, which would just be, you print it out, or in the editable version, which is a PowerPoint. So that goes with all of them. So the emotions chart, a tool that describes and shares emotional states. We have it in English or in French. And again, you can edit this to have your own languages. Sorting emotions. This one we did start getting some Indigenous language translations, as you saw earlier. So we have them in Cree. This is something that we're continuously working on, is expanding the languages that these resources are offered in. So we're currently working with other translators and other Indigenous languages. And actually, if anyone here has any Indigenous languages that they, often see, hear, work with, etc., that you think would benefit you, we'd love to hear about it. Because that'll just help us, kind of prioritize or, maybe scope out new resources and staff that could help us. But yeah, so as we keep scrolling through, this is where we can see the rest of the activities. Again, you always click on them. So they'll say editable, EN is for English, or FR is for French. And as we add other languages, of course, we'll write them out. So how strong are you? The holism. This one here is an activity sheet where it encourages thinking through ways of remaining spiritual, physical, emotional, and mental health. The mental coloring pages. So you'll see here the flowers, the snowbird. We didn't see all of them because there's just so many and they're all so beautiful. But as you click them through, you'll see that there are really a lot of different options. This is again from Ngani. So beautiful. And there's just a lot of really great resources. So the planting, growing, a word search, these are all, again, positive and strength-based terminologies that we really want to, expose the children to and youth to. Social media packages. So as you scroll through, you'll see all of these different activities that you can click. Again, totally free of charge. You just need to make that password and that username, and anyone can have access to this. And some of these are activities that were shared with us that were really great. And some of them are some that we've developed. So this is continuously growing. You can keep looking back to see if there's new resources. If you ever have any suggestions on resources that could really help other communities out by being in this one central location, then again, we're always open to hearing about it and learning about it. And then we'll assess whether or not it fits the criteria that we've talked about in the past. Before I continue, do we have any questions?
Mia answered one in the Q&A box, but others can't see it. So I'll just read it out for folks. The question from Hannah was, can you tell us how the results of the children's health and well-being measurement is used within each community? How do you determine the stepped care needs? And is it based on the results of that measurement?
Yeah, great. I'd love to hear Mia's answer before I go in and maybe
I'll read what I wrote.
Yeah.
So I answered, the measurement tool is really to empower Indigenous communities when it comes to the children and youth in their communities and their health and wellness. So communities can use our measurement tool to understand the needs of children for program evaluation purposes, clinical assessment, and other forms to receive funding opportunities. So Lily, if you want to add.
Yeah, no, I think that's pretty good, Mia. Thank you. You nailed it for sure. Again, with the stepped care, we really did look at previous work that the ACHWM has done. This resource hub is, it's young, it's a year old, whereas the ACHWM, our survey portion, was developed back in 2014. So we do have years of experience with working with Indigenous youth, working with really great collaborators and partners like our social workers and our psychologists and educators and elders. And it's with that wealth of knowledge and experience that we were able to develop the stepped care process that we really base ourselves off of.
Do you receive results back from the tool when communities use it to see, say, prior to implementing some using some of these resources in community and following?
Yeah, so the measure itself is it's separate from the resources. So the measure is a wellness measure, and you do get resources. And if it's something that you're interested in learning more about, please shoot us an email or feel free to browse the website. There's a lot of information, but essentially it's a measure to assess the individual child. And then overall, once you assess all of your children, let's say in a classroom, then you get this kind of report where it's de-identified. So you don't get the children's names, but you get an overall sense of, what parts of your programs are really great and what parts could really use some improvement. But we developed this resource hub thinking that, whether or not you're implementing the survey, it's going to be useful. But for those who are implementing the survey, this really helps support the children who have shown that there's room for improvement, or even to keep working on their strengths. And so that's kind of the purpose of the resource hub. So they're not exactly linked together, but they do complement each other, the two initiatives that we have.
And there might be just one more question. So Hannah followed up with, she thanked you for your answer, and just how do you determine the stepped care needs? So she's asking, is the measurement tool what determines that, or is that a separate assessment?
The measuring tool can definitely help assess that, because when you use the measuring tool, which is that 62 item survey question, at the end of that, there's certain questions that are flagged that determine whether or not there are questions that demonstrate that your child might be at risk. And so the actual survey process of it is kind of its own. It would be a whole other hour presentation because there's so much to learn about it. It is a really, really great tool if it's something you're interested in. But yes, at the end, it would help you know which children need more help, need more support than others. And then that can help, determine which ones would be in which zones. So it's not a requirement. Some communities might have, or organizations have their own processes of knowing, which children need what kind of help or support or et cetera. But it definitely is a useful tool if you're looking to gauge where your children are at in terms of their health and wellness, and where you could improve, or where your policies could improve, where your programs could improve. And even at the end, you end up with this wealth of these stats and this data that, again, is de-identified to protect the privacy, but that can really help with, even funding opportunities or grant opportunities, if you really notice that there's a gap somewhere. So yeah, I would say that the flagging system and the survey will definitely help you identify where your children are at. But again, it's not a requirement. Like, I don't want anyone to feel like you have to use our survey to use the resources. They're really there for anyone who has access to it. But if you're looking for something to support your children and to support your organization by knowing where you could use some help, then this tool could be really helpful for you. I hope that answered.
We'll see. But there's no other questions waiting for you at this time.
Okay. Thank you, Paula, for being on it. And Mia as well for being in the chat. It's a team effort. Okay. So I guess moving forward with the future of the Resource Hub.
So I've probably said this like 6 times. So we want the Resource Hub to be a continuous knowledge exchange. So we really encourage editing and personalizing of the resources. It's really great. We love to see it. So we update our website as communities share these resources. So as we get them sent in, we will add them to our website so that they're readily available for other communities to utilize. Even if it's not in their language, they could maybe see like the format of like how they incorporated Cree syllabics into it, right? And maybe their version of syllabics can be easily incorporated. So it's just, I think knowledge dissemination is so important, especially among Indigenous traditional knowledge and traditional Indigenous knowledge overall.
Yeah.
Like we mentioned previously, we've sent out physical packages to communities across the country. So communities who maybe don't have access to lots of colored ink in their printers or other things like that. We've also begun the process of adding our resources onto USB sticks. If that makes it easier for communities to download these resources, especially with communities who have low bandwidth in our more remote and rural communities, downloading might not just be a thing. So using a USB is a lot more accessible for those folks. And COVID obviously limited us in collaboration with communities and community members. So hopefully the end is near with this pandemic and we can go out in communities, meet children and see where they're at and know what we're missing, because we're obviously missing some things. So it'd be nice to know. We also wanted to do testimonials of children and teachers and whomever are using the resources to put on our website and our social media to show these great resources off, because we're pretty proud of them. So yeah.
That's really great. And I just wanted to add, Mia, as like a recent example of a training we did when we're talking about like changing some of these resources or making them relevant to you. And it doesn't have to be language. We just did a recent training where one of our communities is interested in doing a gender-based violence aspect to their clinic. And with these coloring pages, I know that they wanted to do kind of some, women empowerment and some, things, specific messaging involved. So again, just a way to customize these resources in a way that can really help support your teachings and your purposes.
So we'd like to say a big miigwech. So thank you to all of our people who have helped us, our partnerships, our investigators, also acknowledging our roots, and to those who have helped us along the way in developing all these resources. It's been quite the team effort, and it's been a really amazing journey creating all these resources. So yeah, miigwech.
Thank you to you too. I've just posted in the chat, last chance for questions. I don't see any coming in. So we can just wrap up unless you have any last words to share.
Yeah, well, if it's not a question about our resources, again, like we would love to hear from you what of course, a lot of you here are working with Indigenous children or youth, or you might have insight that we just haven't come across yet. And we'd really love to hear any suggestions you might have, languages to incorporate, gaps you might see that are missing, et cetera. And it doesn't have to be right now. There is also, a little feedback box on our website that comes to us directly, or contact us, let us know. But we really do value your feedback, and it helps us grow. And we take it very, very seriously. And we appreciate anything and everything that's thrown at us.
Great. I'll be sure to pass along to you any that come through to me. And I'll make note of the folks who shared their emails in the chat and question box so I can pass them on to you.
Yeah, that's great. Thank you.
There's another question in the box. So Ingrid asks, any thoughts for including infant resources, or is there any similar resources for this age group? Like the teenage group, like that's definitely another group we would like to reach. Currently, however, For the measure side of our work, we work with children from 8 to 18 years old, but we're working on a measure that's for the younger kids. So this will easily help us with the resources to incorporate the younger infant resources. So yeah, I think that's definitely important to see resources that are indigenized and reflect their needs as young children. So this is a side note. I'm working with like I previously mentioned, the child psychologist in New Brunswick. She's creating a book she studies emotions and facial structure. So we're working with Indigenous children in New Brunswick on their facial features when they demonstrate different emotions. And we've based this off Indigenous children, actual Indigenous children. So this could be a cool resource eventually for infant children as well, as it will be a book. So
that's it's a lovely resource.
Yeah.
So I want to thank you so much for your presentation today, Mia and Lily, for sharing your time and your expertise. Thank you to all of our members and other attendees for spending this time with us. We hope you depart with some practical knowledge and certainly some very sweet resources to bring back to your organization. Let us know in the evaluation box if you're intending to use some of those resources and how, if you can. Join us on September 22nd at 11 Eastern when we host Joy Pop, Finding Joy and Building Resilience in Youth through a co-developed app. Please visit childrenshealthcarecanada.ca for more information or to register for that webinar. It's always great if you watch live, as your questions and comments really enrich the discussion. But if you can't, the recordings of these sessions are made available after the fact on our Knowledge Exchange Network. So thanks again for joining us today. Thanks to Mia and Lily for this presentation and for those wonderful resources. And hopefully we'll see many of you back here on September 22nd. Bye, everyone.